Today we're going to talk a little bit about prostate cancer. It is the number one type of cancer among men. It is the second leading cause of death among men in this country. And in the state of Georgia, we are not spared. Although there are going to be about 55,000 cases of cancer in the state of Georgia this year, about 7,000 of those will be prostate cancer. So if you don't know someone, if you've not been touched, unfortunately, that might happen just because of the prevalence in our community. So whereas there was discussion about screening in the entire population, that discussion does not need to take place in certain high-risk categories like African American men. We know that there's a 1.7 times risk of diagnosis and almost 2.2 times risk of death. Not to mention, the diagnoses take place with higher staging, meaning more distant disease, more aggressive disease. If we look at black patients, we see a difference on if they live in a poor county versus a rich county. What about Metro Atlanta? This was something a few months ago I was giving a talk and I stumbled upon this in the AJC. If we look at life expectancy just in different counties within Atlanta, the highest area is in Vinings, 87.6 years. The lowest area, right down the street, Bankhead, 63.6 years. Why? We know why. We know why. Just a few studies and even some of the work that we've done shows that when people have access to care, they can do just as well. That's a big factor that we need to spend some time on. Thank you very much.